Well, we have a veterans transitional housing facility in Hebron, and when that was, and it used to be a
Motel.
motel, and when there was zoning change to allow that to happen, and I don't know why there had to be a zoning change to move from a hotel or motel to veterans transitional housing. There was quite a community outpouring in Village of Hebron. I granted zoning for that, or whatever they were looking for, some kind of relief under the law. But it was controversial. And I think in part it's the symptom of the community just doesn't understand what they're doing. And we may need some legislation to protect those types of land uses from being prohibited through local zoning ordinances, because clearly I think there's a constitutional issue if you allow housing for, let's say, um, regular housing for a apartment building. What's the difference if it's an apartment building that's providing transitional housing for veterans? I mean,
When we got the apartments in Crystal Lake, we looked at that, and we had our attorneys look at it, and then we went and met with some Crystal Lake officials. And sure enough, if it's an apartment building and you have temporary people in and out, temporary meaning they don't own it, our transitional living there was the same. Now, we can't provide services there for them. We have that someplace else. But just to be able to set up housing where these guys can live within the confines of occupancy, 3 unrelated people, we had no problem with that. But the places to provide the treatment for that is becoming more of a problem. The transitional services that come with the housing. And certainly there are places within the community to do that, but still it's an education of the communities is what you would suggest. That's interesting.
right. I mean, I think the NIMBYism is the symptom of not knowing what actually is going to transpire, because as far as I know, we have never had one incident of any of our transitional housing where they haven't been just great neighbors, I mean, so I feel that what's happening in our local zoning ordinances isn't any different for transitional housing really than it is for some of the other uses, and local units of government are becoming very selective and very using the zoning ordinance almost as a tool to stop certain kinds of growth that maybe they don't want. And but certainly this kind of growth is not a bad growth to have a transitional facility for veterans in your community.
Well, with the veterans also, going to the VA hospitals, we've got North Chicago, Hines, Jesse Brown, and Milwaukee, all these VA hospitals around here. But their services are shrinking. Their facilities are shrinking, their space is shrinking, and the care that they're providing is shrinking because of VA cuts. Mandatory funding for VA medical is a huge topic. It was voted on in Cook County to be passed as a resolution and put on the primary ballot and voted on by over 95% of the voters. Not that that actually will do anything in and of itself, but where would you stand on mandatory funding for VA medical?
I have no problem with mandatory funding for VA medical. I find it very difficult to believe that we don't already do that. I actually went to college on a scholarship as the son of a disabled American veteran. And there was never any question about where that money was coming from. It was always there, and I paid probably a third of the cost that another student would pay. So I'm surprised to know that there isn't more medical services that are being directly offered. What I think we're experiencing in the healthcare delivery field is access to healthcare. We have in McHenry County, we don't have the ability really to have a county hospital like they have at Cook County.
Thank God.
Yeah.
We don't have one like them.
Right. But what we also don't have is we don't have any federally qualified health clinics. And the reason we don't is because our census tracts have too much income. So we don't qualify. And it's almost like saying that poor people in McHenry County aren't poor enough, when in reality they're having a harder time getting direct medical services than somebody that lives in Cook County. and that's not right either. So that needs to be changed. A county of 312,000 like McHenry County is needs to be able to have a federally qualified health clinic that would provide access to everybody. And quite frankly, I think that's what Governor Blagojevich's health plan should exist of. I think every county in Illinois that has the right population numbers should be able to have access to some kind of healthcare system. And I think the easiest way to do that would be to expand the federally qualified health clinic program throughout the state of Illinois. And then you would have points of service for not just veterans, but any medically indigent person.
But Centegra and Memorial, they provide so much of that work anyway, but it's certainly not enough.
Mm-hmm. Well, Centegra has been very active in pursuing helping McHenry County get a federally qualified health clinic. I mean, they see the benefit of that. We have the Family Health Partnership Clinic in McHenry County that services the medically indigent population with a lot of volunteers, and they're very creative with how they do their drug program, but they don't get any federal money to service. 10% of our population is estimated to fall in that category.
Well, maybe we'll hook up sometime with the McHenry County Continuum of Care. It would include the housing, mental health, and indigent medical. Mm-hmm. Because they certainly have an effort. They try. I think they have a number of stumbling blocks, but it's certainly something here in McHenry County. People should investigate what the Continuum of Care does.
Right. I think the problem I have with what I'm hearing on the national level, we have one presidential candidate talking about single-payer health care. And when you look at single-payer health care in around the world, primarily in Canada, it just doesn't work. It's not the kind of healthcare system we're used to. We're used to, in this country, people paying for health care because the vast majority of the population has some kind of insurance through their employer, and somebody else is paying the big portion of the bill. But what we need is a healthcare system that everybody has access to, some form of health care that puts you in charge and your doctor in charge of your health care, not the government. And in Canada, you get told very often if you have any kind of procedure, whether it's a brain tumor or carpal tunnel syndrome, just that you have to wait 6 weeks to get an MRI. In the case of a brain tumor, and we had somebody testify that was a case in Ontario. And a thing like a carpal tunnel surgery may take 8 months before you would get it. We're not going to put up with that kind of healthcare system here in the United States. So I'm looking to try to solve healthcare, not just for any kind of veterans assistance program, but for indigent and those who don't have access to health care now, because I think that's what the issue is. And when you take somebody who can't access a healthcare system and you put them in the emergency room and they get the most expensive direct service, and that drives the cost up to everybody. So, having people covered is what we need.
Well, they still need to be able to get to the facilities, and it takes me to transportation.
Mm-hmm. One of my favorite topics, by the way.
McHenry County is a big funding source for Chicago's mass transit. I think that's wonderful that McHenry County can do it. I think it's wrong that McHenry County is paying for it. I know that that's your view as well. But how did it happen? How did McHenry County, our taxes, and all of the state basically, to bail out Chicago that these counties around the state don't use? How did that happen?
Well, I like to say it this way. Because McHenry County doesn't like paying money directly to the CTA, doesn't mean we're not for mass transit. We do have mass transit needs here in McHenry County, and we don't get any services. I mean, 100% of our taxpayers pay the tax, and we only have 1% of our people actually using mass transit or even having it available. If you live in Marengo, you have no mass transit. If you live in Huntley, you have no mass transit. If you live in Hebron, you have no mass transit. If you live in Spring Grove, you have no mass transit, but you're paying the tax.